Hi Luann, my name is Kristen and I'm a physical therapist. From the history you've sent is that you're having quite a bit of knee pain, particularly when you're walking up and down hills, and you described it just below the kneecap. One of the most common sources of knee pain is patella femoral. They call it patella femoral pain syndrome. And what it is predominantly is a muscle imbalance. Some muscles get tight, other muscles get weak, and that causes the kneecap, the patella, not to track appropriately, particularly aggravated when there's a stress going downhill, downstairs, that eccentric contraction of the quad. So what I'm going to start out with is I'm just making an assumption that the structures, without me seeing you and testing you, I'm making an assumption that your knee is like most of the knees I see in the clinic, and that is that there's certain muscles that are tight. And we're going to start by stretching those muscles out. Then you're going to practice that and see how your pain comes. Sometimes with something like this, because there's so many factors influencing the kneecap, that you may need to see somebody in person so they can really take a good look and figure out which muscles are the contributing factors. But if you're like a majority of the patients, these stretches should help you. Before I show you the stretches, what I'd like you to do is when your body's experiencing pain, usually there's an inflammatory process going on. There is a bursa, or a small fat pad, that does sit underneath your patellar tendon, and the reason why that becomes so painful is that it's highly innervated with nerves. So what we want to do is control the inflammation by using cold packs. So putting an ice pack right around the knee joint after you've exercised. It sounds like you're an avid walker, so after you've exercised, if your knee pain seems a little aggravated, then go ahead and use cold packs to help control that inflammation. It's a fine balance between rest and activity, and what I like to encourage people to do is to do active rest. Find ways that you can stay active, get your cardiovascular exercise while your knee heals and repairs itself. So some options would be to swim, to ride a bike, ride a stationary bike, versus walking and jogging, which is what you're doing, just until your knee pain calms down a bit. You said that your pain is on average about a 5 on a 0 to 10 pain scale, and it can increase to a 7 or 8, and that's pretty significant. So it's very important that you follow up and get some help if these stretches do not help you. So the first stretch, aside from the cold packs and controlling the inflammation, I'm going to show you 3 stretches to work on, and the first stretch is a quad stretch. The best way to do this is to perform in standing. You're going to hold on to something for support and reach behind you and grab your foot, and you're going to stretch the front of your leg. The important part is to keep your knee pointed straight towards the ground. A lot of times people will do it like this and you're not actually getting a stretch of the entire quad. Also, if you tuck your bottom under you slightly, you're going to feel it up here in the hip flexor also, which often accompanies a tight quad. So you're going to hold this stretch for 15 seconds and then repeat it on the opposite side, where you're going to grab your foot, knee pointed towards the ground, and your bottom tucked slightly under you so you feel it all the way up into here. And you're going to hold that for 15 seconds. And each stretch you perform, you're going to do each stretch holding it for 15 seconds, and you're going to perform 3 on each leg. So that's the quad stretch. The next stretch is a hamstring stretch. You can lie on your floor, the floor or the bed. You're going to start out with both legs straight. Then one leg you're going to grab behind your knee and then stretch your foot up towards the ceiling. And the goal is that you get a nice straight leg, heel pointed straight towards the ceiling. And as you can see, I'm not quite straight because my hamstring's a bit tight. Often what I see is people are able to go about this far or even this far before they feel when they feel a stretch in the hamstring. So the key is that you feel a stretch. You hold it for 15 seconds, and then you relax and repeat it on the opposite leg. So go up as far as you can until you feel a stretch. Hold it for 15 seconds, and then repeat it 3 times. The third stretch I'm going to have you do, you cross one foot over the opposite knee, and then pull that knee up towards your chest. And where you feel that is the hip muscles right on the outside. You'll see it a little better when I do it on the other leg. Again, you're going to hold this stretch for 15 seconds, and then repeat it on the opposite side. Cross your ankle over your knee, and then pull that knee up towards your chest. And again, you should feel a stretch right up through here, and often down the lateral aspect of the leg also. These muscles do affect the control and the mechanics of the kneecap. So loosening these tight structures can help take the pressure off of the kneecap. So you have your quad stretch, your hamstring stretch, and that's actually a glute and piriformis stretch. And also affects the IT band. So, Luann, I hope that helps you. Feel free to contact us if you have any further questions. Be well.